And good morning. It's Dr. Deuk broadcasting live from the Surgery Center of Vieira and Deuk Spine Institute. We're going to be performing a Deuk laser disc repair, L5-S1. It's Friday, April 28th, 2023. Our patient has lower back pain at L5-S1 and she has SI joint pain. We'll be treating her SI joints after this procedure with the Deuk plasma rhizotomy. Just hang in there, okay? So she's awake, as all of our patients are at the beginning of the procedure. The reason for that with lumbar and thoracic is you want to make sure that the navigational pathway we're using with the needle is not too close to any sensitive structures like nerves. That looks really good. You can see from her x-ray she's got scoliosis. We're not here to fix the scoliosis. A lot of people ask me, do you need to fix scoliosis to get rid of pain? The answer is no. You do not need to fix scoliosis to get rid of back pain. As a matter of fact, that's what we used to believe for many years, but it turns out that's not the case. We can get rid of the back pain without fixing the scoliosis. We do it all the time. Just relax. I know that's your bad disc. It's her back, I'm sure. We're so far away from the nerve root. All right, so the needle, if you look at the lateral view, it's a little farther forward I want it to be, so I'm going to pull it back just a centimeter. All right, there we go. So, are you okay?
You okay?
You're doing great. Everything's going very well. Just lay still. We're going to be done just very soon. Now, this patient has many disc issues along her spine, but if you look at the MRI and you base your decision on the MRI, you're not going to make the right diagnosis with her, especially. She's a perfect example of why we don't look at MRIs to decide where to do surgery. We look at the patient. I always say this, it's an important point. MRIs don't tell you where pain comes from, patients do. So you've got to ask the patient where their pain comes from. And when I did, she told me the pain is here, right here. Well, this is the L5-S1 disc. That's it, it's the L5-S1 disc. And she also has pain coming from her SI joints, which are here. Okay? Is that bothering you? Yeah. We're going to fix that next. Are you comfortable right now? Okay. Can you hear me okay? What'd she say? All right, just relax. What's wrong? You want to wait?
Yeah, I'm just trying to...
Yeah, no problem. All right, so we're just getting her positioned a little better with the anesthesia, getting her blood pressure cuff on. We're just making a little adjustment with your blood pressure cuff, okay? Give us a second. We're going to put you to sleep in just a minute, but I need to check something first, okay? So far, everything's going well. So we're starting with doing the Deuk laser disc repair at L5-S1. If you look at her MRI, L5-S1 looks normal, almost normal. But it's not. There's a small area in the back where there's a tear in the annulus and there's a bulge. It's called a disc bulge. So she has a bulging disc at L5-S1. Is a bulging disc a herniated disc? It is. Let's run our video showing the audience why do herniated discs, annular tears, herniated discs cause back pain.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. I'm glad you could see why the disc cause pain. So we're gonna verify that disc is causing pain. Lay still, okay?
Doing great.
All right. How bad is that on a scale of 1 to 10? How high? 8. Is that where you get your back pain? Yes? All right, guys, this is really incredible. Look at that discogram. Show us the discogram, Henry. Okay, that's a 8 out of 10 disc, 8 out of 10 pain. It's concordant, and the tear in the back, can you see it? It's above the needle. It's tiny. Look at that thing. Yes. Keep going. Follow it. Come on. No. Bring the arrow to the back of the blob, and now there it is. There's a little line right there. Go. Follow it back. That's it. Can you guys see that, Henry? It's literally barely any wisp of dye going through it.
Yes, we can.
All right. So, wow. Okay. This is the important point here. If you look at the MRI only, and you don't understand where pain comes from, you will look at that L5-S1 and you will say there's nothing wrong with it, but I could see on the MRI on one of the cuts, it was definitely a tear in the disc wall, the annulus, and we just did a discogram and we just confirmed that it is causing pain, for sure. She has 8 out of 10 pain. It's concordant, okay, concordant. Now I gotta admit, I thought there would be a bigger tear than that. That's a tiny tear. I mean, it's small and skinny, but it's significant. So it's definitely causing her pain. So I feel good proceeding with the DLDR at L5-S1 to get rid of her disc pain at L5-S1. She ready?
Yes.
All right. Snoozy. And I can feel it's under pressure. Shot. Pressure from inflammation. You know, when you have inflammation in your body, things swell, right? If you have inflammation on your hair follicle, we call it a pimple, it's swollen. It swells out, and it's tender as hell, right? You touch a pimple that's all swollen and red, it's tender. It hurts. That's exactly what we're dealing with in the lower back. Now, when you have acne and a pimple, the swelling and tenderness comes from an infection of the hair follicle. This is not an infection of the disc. This is inflammation. So the infection itself, bacteria by themselves don't hurt. If they're in your body, moving around, doing stuff, they don't hurt. It's your body's response to the bacteria. It's called inflammation. Your inflammatory system comes in and starts attacking the bacteria, and it creates a huge painful mess for your face. That's where you get red and swollen. So the redness and swelling isn't directly caused by bacteria. It's indirect, and it comes from your inflammatory system attacking and reacting to the bacteria that are there. So it's actually inflammation that causes pain. This disc is under massive pressure. I keep pushing it in and it's pushing out. Look at that. Look, can you see this? All right, let's get an x-ray. There, shot. All right, it's in. Now watch here, Henry. Can you see this?
Yes, we can.
This is how much inflammation's in there. Look at it, just pushed out. Look at the x-ray, take the x-ray. It literally, the disc pushed my dilator out of the disc. Can you see that? Let's try it again. In, and watch this shaft move, okay? I'll move my hand out of the way. I'm gonna let go, 1, 2, 3, and watch it move. There it is. You see it push out?
Yes, we did.
I mean, that's so much pressure in that disc. That's all inflammation pressure. This is so important. This is so important because every single doctor in the world besides us would look at this MRI, and she's gone to other doctors, and they said there's nothing wrong at 5-1. But it is full of pressure and inflammation and causing horrible pain for her. And they just blew her off. And she came back, she came to Deuk Spine, and we figured it out, and now that pain's gonna be gone. So I'm surprised at how much inflammatory pressure is inside the disc, but there's a lot. Is that it right there? Is that my shot? So I'm going to have to hold this dilator in while I put my tube. We're going to do the whole surgery through this tube. But the point I'm trying to make, folks, is you've got to be careful who you go to fix your back, because most doctors don't know about the inflammatory cause of back pain. They don't understand that it's inflammation. We figured it out at Deuk Spine. There's a few other doctors in the world that understand that. Shot? But if you don't go to the right doctor, you're going to live in pain the rest of your life. All right, good. So we're in. Shot? Let's see if it's pushed. Oh, it pushed my tube back too. It's pushing the tube back. Look at this. Look at it moving back. All right, so look at this. There's tube in. Shot. All right, now watch. I'm going to let go. Watch that. That tube's going to move backwards. All right, it's moving just a little bit. It just moved like a few millimeters. There it is. It moved a full centimeter, 10 millimeters backwards. But I think we're okay. So what's moving this tube out? We never see that. What's pushing it out is the pressure inside the disc, and that's abnormal pressure. It shouldn't be there. There should be no pressure in a disc. But it's pressurized because of swelling and edema from inflammation, which goes along with her complaints of pain at L5-S1. So this is a very important case. Henry, can you add this case to my educational cases?
Copy that.
And the name of it would be called internal disc disruption, IDD, internal disc disruption, the name of the file for this one. What is internal disc disruption? It means there's like an explosion that happened in the disc and it's all damaged internally, but you don't really see it on the MRI. Most doctors would just pass it over, not even think about it being a cause of pain. That's why this case drives home the most important point I make all the time. I need irrigation, guys. There's no irrigation. And that point is, MRIs do not tell you where pain comes from. Patients do. And you've got to listen to the patients if you want to solve their pain problem. And doctors just don't listen to patients anymore. Wow. I hope there's a lot of inflammatory tissue there. All right. I hope it hasn't pushed us out. I don't think it has, but let's see that. Now we're going to see an explosion of blue, I'm sure. Hold this down for me. I got to focus this thing. I'm trying to get it focused nicely so we can see. All right. We're ready with the laser. Let's get started. Scar tissue with the annular tear. Huh? Yeah, starting to see the blue. Let's see what happens. I have to figure out where we are. I know we're at 5-1, but how deep are we in the disc? See, that disc looks almost normal on the MRI, but it's definitely not normal. I feel the scar tissue, a lot of it. And you can see the blue stuff is not normal blue. Like, it's not young disc herniation. It's actually got some older herniation in there. It's kind of scarred up blue. All right, let's go ahead and run the video showing how does this Deuk laser disc repair procedure work to get rid of back pain coming from a damaged disc in the lower back.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back. Now you understand how the laser works. We're cleaning an annular tear. In this case, it's a very small annular tear, but it was significant because it was causing horrible pain and inflammation. So much inflammation, it literally was shoving the my tool back out of the disc once I got it in. We're not used to that kind of a warm welcome from the disc. Normally, the disc doesn't stop us from getting in and doing our job, but her discs were pushing us back out. And that means there's so much swelling and pressure inside the disc. Normally it's zero. You might get a tiny bit, but not enough to push a piece of metal out of your disc. So it's very unusual. But it goes along with her complaints because she's having so much pain down there that when you look at the MRI, you go, that's not so bad at all. But then you get in there and you see it's a lot worse than the MRI. So she's an example of an MRI that's almost normal looking at 5-1. It would have been read as normal by most doctors, but it's not normal. And you can see it's not normal when you get into it. So that's why MRIs are not that sensitive. You can't rely on an MRI to tell you if somebody's having pain or symptoms, okay? MRIs are good at seeing big abnormal changes, but small changes, significant small changes, like inflammation in a disc, they miss. They miss all the time. And that's why people are suffering. Number one, their doctor doesn't understand the inflammatory nature of disc disease like we do at Deuk Spine. Number two, the diagnostic tools being used by the doctors are not adequate to find the problem and identify it. Or the radiologists are not good enough to identify it on the MRI. So either the MRI scanner itself is not able to pick up on the abnormality, like in this case, it was barely able to pick up an abnormality and I barely noticed it, but most radiologists, 99.9% would miss it. And most MRI scanners might miss it because it's so subtle. See all the blue nucleus there? All scarred up. See how it's just stuck together? The laser, normally it would be fluffy, but it's so scarred up and swollen. This is very abnormal, but you really couldn't tell. I mean, this is a huge area of abnormality, but you couldn't really tell on the MRI. So anyway, the main point here is you can't trust the MRI. You got to trust yourself, your body. You know your body better than an MRI scanner knows your body, okay? And if you're feeling pain and the doctor's telling you there's nothing wrong, they can't figure it out, or if they send you for pain pills or shots, therapy, they're missing the diagnosis. You need to come to Deuk Spine and we'll figure it out for you and we'll fix it, okay? That's what we do at Deuk Spine Institute, better than anyone in the world. It's worth traveling wherever you are in the world. If you're suffering with pain, come here and we'll solve your pain problem. I mean, of course, we're talking about spine pain, not like, you know, there's lots of causes of pain, right? Headaches, things like that. But we deal with spine pain. Now we are going to be getting more into big joint pain as well in the next year, such as hips, shoulders, knees. We're going to start treating more big joint pain because we have developed this new rhizotomy technique that is amazing. And it's a one and done rhizotomy. By the way, the thoracic rhizotomy from yesterday, that lady, yeah, it looks like the scope is warping a little bit, getting some warping of the image. The thoracic rhizotomy lady, not just the plain rhizotomy, but the DLDR lumbar 4-5 and thoracic rhizotomy, no more pain in her lumbar, gone. And her thoracic facet pain is gone. She just has surgery pain. So it's a new kind of pain she didn't come with. And that should go away. Her muscles are sore. She's doing really good. Yeah, yeah, no, the thoracic pain she had before is gone. She just has muscle spasms. She has swelling from the surgery. Just her muscles are angry because we burned the hell out of the facets. I'm sure we burned a little bit of the muscles too, you know. It's part of the procedure. Unfortunately. Yeah. Anyway, she's very happy. She's from Indiana. She's here with her uncle. I thought that was her husband. I called him her husband, and she told me it was her uncle. So anyway, innocent mistake. All right, any questions from our audience?
No current questions.
All right. I'm sure our audience is not used to us operating on a Friday. I need less than 5 minutes. What did you say? What did you say? I didn't hear you. Oh, yeah. But why would the morale need anyone to keep it up? We should be very happy we're all doing what we came here to do. I know I am. Nothing makes me happier than curing pain. Ending suffering. It's not even about curing pain, it's about ending suffering, you know? Do we have any viewers at all?
Of course, yes.
All right. Oh, the other thing that's of interest with her is we did her Deuk laser disc repair at L3-4, L4-5 in the past. She got 100% relief of the pain there. And she came back with L5-S1, the disc below, which, again, on the MRI, it looks virtually normal. 98% normal. So when she showed me where the pain was, she said, it's my L5-S1. I said, you know what? You're right. It is your L5-S1. But nobody where she lives took her serious. She's from Idaho. So they got frustrated with the doctors ignoring her complaints and not fixing her. So they came back to Deuk Spine for her second DLDR this one at L5-S1, the bottom disc. The other DLDR was done above at L3-4 and L4-5. And they were so happy with the pain relief at those levels that she came back for this one. Just look at this nucleus, totally abnormal, you know what I mean? So very surprising to see how abnormal it was, given the fact the MRI 5-1 looks so normal. So we definitely did the right thing. This disc was under a lot of pressure, and a lot of it was just from chronic inflammation and scarring. Scarring of the nucleus pulposus, the blue stuff.
I got a question for Henry.
Question for Henry, yes.
Henry,
Henry, we
Yes.
got a question for you from Dr. Berndes.
Yes, sir.
how come, I'm obviously a friend on Facebook of Deuk Spine. How come sometimes I get a notification that it's live and that they're operating, we are operating, and other times I don't get the notification, but we are live? That's what I'm asking.
Yeah, Berndes is saying on Facebook, a lot of times he's subscribed to Deuk Spine, and he's friended us, or whatever you do, I think friending. And he says a lot of times he doesn't get notifications about the live stream.
I see.
There were a couple times I wanted to send it to my son, and didn't go.
All right, just about done. Still a little bit of inflammation tissue there. I'll be done in 1 minute or less.
That has me curious, though. I'm going to look into that, Dr. Berndes.
Thank you.
Yeah, because I didn't get it this morning.
Well, he didn't know we had a case this morning. That's not, yeah, it's more our fault for not telling him, but. All right. Went well. Was worse than I thought it would be, but I think she's going to do fantastic. Any questions before we wrap this up?
No current questions.
All right, well, thanks for joining us. We're not going to do our Q&A because we do have telemedicines, and I've got to get over to those. But again, thanks for joining us. One more irrigation. But everything went well. She had 8 out of 10 pain, 8 over 10. That's a huge 8 out of 10 pain is big pain from the L5-S1 disc. And it was her typical pain she gets every day. So it's not some new pain that I just created today by sticking things in her. So all done.